good point. Let's see. How's this? Ooh, yep, that works, I can tell. All right, well, good morning, everybody. Thank you for joining us on the very last first morning of the conference. We appreciate you coming and being a part of this. I'm Emily Jamiefield. I am one of 5 presenters this morning, along with Drs. Reisig, Thomas, Lewis, and Kropp. I knew I was going to do it. I'm sorry. We are all coming to you from the SAEM Education Subcommittee, which is how we all met each other around this time last year. And the presentation that we have for you, we've titled A Bad Case of the Zoomies, Deciding on Virtual versus In-Person Didactics After COVID-19. Okay. We have no disclosures for you today. And it will surprise no one that this topic is a topic because of COVID-19. So in 2020, we all as educators had to make a very sudden and substantial shift from teaching our residents primarily in person to primarily virtually because of social distancing requirements. This was a big shift that we all were uncomfortable with at the time, but got very used to out of necessity. And over the 3 to 4 years subsequently, we all had to decide, do we keep things virtual? Do we switch back to in-person? Do we go entirely back to in-person as those social distancing restrictions lessened and then lifted altogether? And what we found when we were all talking at SAEM last year is that across our 5 programs, there was no consistency as to how we'd made that decision. Our different residency programs all had different balances of in-person versus virtual time, and we were curious, how true is that across the nation? Because we had really no insight as to how different programs were making these decisions. So we got our heads together and we tried to answer 2 questions. 1, what does the literature actually show? Are there real benefits to virtual education that make it something that we should be continuing to include in our residency didactics, even if we don't have to per social distancing restrictions? And 2, what does the national landscape actually look like? What are programs doing and how are they making the decisions to choose between in-person or virtual education? So today, over the remainder of our time, we're going to try to answer those questions through a number of different things. So first, we're going to go through some of the published literature and look into what data is there that supports or doesn't support the use of virtual conference specifically. And 2, we're going to go through a survey that we put together and put out nationwide that tries to answer the questions of what are programs doing and why are they doing it. And 3rd, we'll discuss some of the pros and cons of the various formats through some facilitated discussion. And with that, I'm going to pass the mic off to Dr. Thomas for some of our review.
All right. Wonderful. Okay, so we are just going to dive really quickly into the literature review of actually what people were doing, what they published after this, the pandemic really began. So we included in our PubMed search all articles that were published from January 1st, 2020 to December 31st, December 31st, 2023, really wanting to capture everything that had happened, that had been published from just before the pandemic onset until as recently as we could manage while still making this a quality presentation. So what happened is that we found 181 results which had to deal with residency didactics in emergency medicine that were not specifically focused on one aspect of didactics. So for example, we excluded articles that were just about simulation, that were just about large group discussions, that were just about X, Y, or Z aspect of conferences. And so what we found is that we had these articles separate themselves out, 18 relevant articles by the end of it, into 4 different categories of what we really knew and what we know at this point about, or what's been published at least, about virtual didactics. So it will surprise no one that the GME response of various institutions and also nationwide GME response was one of the things that was most widely published. So the ACGME sent out a survey that had a 99.6 response rate, of which I am insanely jealous, about what aspects of medical education were most affected by the pandemic. So after clinical rotations, residency didactics were the second most affected thing. Now, all of these institutions that were surveyed and all of the papers that were put out talked about using video conferencing platforms like Zoom, Microsoft Teams, et cetera, to deliver their didactic content. And so as an example, 100% of New York State programs actually had gone to a completely virtual didactic format after the social distancing restrictions onset. So let's talk a little bit about the meat of this matter, right? Like, what were the actual educational outcomes? So we divided them up into, in true education fashion, various Kirkpatrick levels. So there were 8 articles that people had gathered learner reaction data to the implementation of these virtual formats. There was one paper that actually used the COVID forced move to a virtual didactic as a natural experiment to compare OSCE scores, to compare multiple choice scores, both before, during this in-person teaching, and after. They framed it as millennials and how millennials learn, which I found really interesting. But anyways, the last one was they tried to gather some sort of behavioral data about resident and faculty engagement in virtual versus in-person format. Now, this is really difficult, and really the only way that they were able to do this was self-report, which, as we know, is not necessarily as reliable as objective evals, but there was a little bit of data that they were able to get, so that was kind of interesting. So to jump into it, virtual conference, and when this virtual format was initially introduced, really overall the reactions to this were generally somewhat positive. So people liked having the flexibility, the convenience to be able to implement asynchronous curriculum more widely. They liked the ability to have a little bit more convenience and kind of viewing from home. But really where the issue came in and where the strongly negative feeling and the sentiment came in was interpersonal engagement. This was universally felt, or perceived at least, to be really, really poor in virtual formats. So again, we don't know whether this is actually the case and whether this is objectively the truth that people engage in virtual format didactics less than in person, but this is certainly the perception pretty much universally around the papers that we found. And then, even though we didn't focus in on papers that delved just into each one of these things, there were sort of mentions throughout of different types of learning that we have during didactics and what the reactions were to that. So again, universally, large group lectures felt to be a really good use of this format. Small group discussions, it was sort of más o menos. Some people said we really like being able to move people into these breakout group rooms, it's really efficient. Others said, yeah, we really don't have the engagement that we saw in in-person formats before. So for the hands-on teaching formats, this should surprise nobody that people didn't like this, right? People didn't like the attempts to try to teach procedural teaching, simulation, et cetera, virtually. But then there was a mention of gamified teaching. So someone particularly broke this out in their paper and said, what do we feel about trying to gamify teaching virtually? And this actually was also poorly received on the virtual format, which I thought was kind of interesting. So then lastly, that last category of published literature, there was this one validity evidence paper for an assessment tool, and this gets convoluted, so I am sorry. It is an assessment tool of the cognitive load of virtual lectures. So you are trying to assess what is the quality and what is the cognitive load of this virtual lecture that was delivered. So this was published. Validity evidence for use of that tool is actually pretty well done. So with that, now that we have a little bit of an understanding of the landscape of what we know about virtual didactics, I'll hand back to Dr. Jamie Field to talk about our survey.
All right, so with that knowledge that we'd gathered, we wanted to kind of dive in and figure out what are programs across the country actually doing and how are they making those decisions. So we tried to answer those 2 questions primarily with a survey. What are EM residency programs doing now? And also, which components of their conferences are they trying to have be either in-person or virtual as their ideal modality? To do that, we made a survey via Qualtrics online, and we first piloted it with 4 of our programs, had some iterative review and revision of the survey, and then put it out nationwide. The way that we first popularized the survey was through the CORD PD community listserv, which had pretty good responses. We posted it there twice, and then through a list that we had acquired from ERAS of the 282 ACGME certified programs, we then targeted programs directly once or twice via email to try to increase our response rate from there. We had a total response rate of 174 out of what ended up being 281 programs that were actually active, for a response rate of 62%. Those responses encompassed the 2023-2024 academic year. We specifically asked directors to talk about this year of their academic programming. And we asked that preferentially PDs fill out the survey if they were able to, or that they delegated one member of their education team that knew a lot about the conference format to answer the questions that we put forth. So with that information, I'm going to pass the mic off to Dr. Kropp, who will go over some of our results.
Please, the podium mic.
Perfect.
Off for a minute. All right, so I'm Will Kropp from Michigan. So I'm going to go over our Figure 1 data and then our primary outcomes from the survey. So this is just the geographic distribution of the programs. We generated responses from 174 programs as a part of the survey. And you can see that we have good geographical distribution of all the AAMC recognized regions, pretty well spread across the board. So for instance, we have clustering that's pretty similar to where emergency medicine programs exist. If you look in the upper Midwest, AAMC calls that the East North Central region, and 22% of our responses came from there. Or if you look at the Atlantic region, that's one that includes New York. You can see that we had about 20% of our responses come from there. And then beyond that, the other 58% of responses were pretty well evenly distributed among the other geographical regions. So here's some of our Table 1 data, and this is the demographics of the respondents to the survey. So you can see that about half of our surveyed folks respond that they are from academic institutions. It says, 47%, whereas about 35% identified their programs as being from a community setting, and then around 10% from a county setting. You'll also notice that we had a good split of 3-year versus 4-year programs. So we had 76%, about 3/4 report that they're 3-year programs, and about 20% report being 4-year programs. This is more or less congruent with what we know about data from nationwide surveys. So like in 2021, 20% of programs overall were 4 years. So this is more or less congruent. It's maybe a slightly enriched sample for 4-year programs, but you sort of expect that in academic settings. And then program size ranged from 6 residents all the way up to 100 residents. So I didn't realize there was that much range in the size of programs, but our median size was 36 residents. We also asked who filled out the survey. The program director responded 72% of the time. And as Emily pointed out, we asked for the person who was most familiar with the didactics at the institution. So we had, I believe it was 12% of the time it was an associate PD who made that decision, and then 9% of the time it was an assistant PD. And then we had, within those other 6 responses, an interesting mix of some admin staff, a couple of vice chairs for education, and then we had 1 chair of the department actually fill it out. And here's what we found. Roughly half of programs, or 48.3%, report they use only in-person didactics. And then the other half used what we're calling a hybrid model, where they used some amount that were in person and then some amount that were planned to be used as virtual didactics. And I don't necessarily mean something where they have an in-person and it's just being live streamed for other people in other locations, but rather planned as being virtual only. And this is the primary result of our survey. So the stacked bar chart gives us the responses of each program, and each bar is an individual program. So here we have blue representing those who are in person only. And then orange is all the components of their curriculum that are intended to be virtual. So you can see an enormous preponderance of programs saying that they are only in person. The data here is a little bit skewed. You notice our N is only 168. There were 6 programs that failed to give complete data about their breakdown of how they spend their time. So if we just cut to the section on the far left, and we show those who have some amount of virtual conference time, you can see that the vast majority of programs use 25% or less. And then we had a few outliers over there at the far left of the screen that use up to 75% of their time virtual still. And then there are a few in the middle there that have somewhere in between 25 and 50%. But this whole tranche of programs on the bottom right are using primarily in-person didactics. So we found this to be a little bit surprising, just learning that most people are in person most of the time now. So I'll turn it over to Chris at this point so we can move into a bit of a discussion section on this.
Good morning. Am I on? Good morning. I'm Chris. I'm from Weill Cornell. We wanted to pause here for a moment and hear from you. As Emily mentioned early in the talk, immediately post-COVID, we were more or less 100% virtual by necessity. Now, as Will pointed out, we're about 50-50. So there's a story there of how programs conscientiously stuck or twisted back to in-person versus stayed with the hybrid model. So just by way of show of hands, who is affiliated with a program, a residency that is 100% in person? Okay. And I'm assuming by extension, the other show of hands are hybrid programs, people who have virtual components? Just
100% hybrid, 100% virtual.
You're 100% virtual?
Non-emergency medicine, though.
Okay.
Yes.
What discipline, out of curiosity?
Residency program in dentistry.
In dentistry, interesting. Okay. Is there anyone, because it's not in our data set, who's 100% virtual in EM? And by 100% virtual, I mean 100% conference virtual, not like holograms. Okay. Can I ask somebody who's from an in-person program, if you're willing to kind of narrate the story of how you went back to being in person? Yeah.
So like most of the programs, I'm Mary Ann Eanes from LSU Shreveport. Like most of the programs, we were all virtual when COVID happened, and we saw our residents were not getting to know each other. And we actually had the chief residents come to me and say, as soon as we can go back to in-person, can we go back to in-person? So it was actually led by my residents saying that despite the fact that they love going to conference in their pajamas, they felt like they were not getting the socialization with each other that they needed to have. So as soon as the restrictions were lifted in Louisiana that we could be within 6 feet of each other, we just immediately changed to in-person. Now we do have a virtual component in that we do stream, we do still Zoom for people who are either on vacation and still want to come to conference, or if they are on an ICU rotation that they can't break away for the entirety of conference, they can still come for the portions that they can. So, but those are the only two times that they can come virtually. Otherwise, they are supposed to be there in person. And the residents like it so much better. And I, as a program director, saw my residents. I was actually really sad during COVID because I saw my residents were not a close-knit group at all, particularly my interns. So it brought me joy to bring them back and have them be, a group, a cohesive group again.
Thank you. Is there anyone from a hybrid program who's willing to share how their program decided to stay where there are? It's okay if not, I'm just curious. No? That's okay. Because part of our survey by design was not just to, I'm sorry.
I just wanted to make a comment.
Yeah.
Just to elucidate that. So I'm a new program director here in East Valley, Phoenix, and I was just coming out of an educational technology fellowship when COVID hit. So I was core faculty in South Carolina. It's kind of interesting timing for me to really put my skills to the test and see how to navigate conference and help my team to produce didactics. And I would agree with the fact that it was very hard to engage despite my real more in-depth understanding of how to utilize educational technology tools like interactive gaming. I published a study on doing a virtual escape room with good results. And so I found that it really isn't something I'm interested in doing in our program. I think that you have to have the option for those learners that are away or whatever, but for me, the whole point of in-person didactics is to do active learning and to get higher on the Bloom's taxonomy of learning so that you're not just reiterating information, you're actually having active learning components. So while we'll be 100% in person, really the focus is on active learning and engaging and cases and things that will expand their learning beyond just what you could get from a virtual lecture. So that's my thought process.
Hello, Robbie Paulson, WashU. I was at University of Cincinnati at the time when we were in the COVID pandemic. And we had the same kind of cultural considerations that Dr. Edens did. One innovation that we actually kept post-COVID is we actually kept our Slack space. So we kept Slack going. And we were using Slack as a discussion platform because the Zoom chat just couldn't accommodate the very rapid discussion. Had kind of honestly limited more options for rapid expression like emojis, and couldn't really adapt to, oh, well, here's this resource that pertains to this lecture and stuff like that. And the residents loved it and the faculty loved it. And so we've kept it. Cincinnati still uses it. I still log on to their grand rounds remotely because I can when I'm in St. Louis. And so I can still interact with them, at a distance. So their grand rounds format is still live streamed, but even the in-person attendees can interact with those in the virtual space and interact with each other. And particularly during morbidity and mortality or other small group discussions, it's a very, very lively feed of sharing cases, sharing resources, posting papers, and sort of like one-upping and also congratulating each other. So like, hey, great job, great lecture. So from a group cohesion and culture standpoint, it's been a great point of support.
Thank you all for sharing. What I'm hearing from the sentiments you're echoing are that one of the main drivers is engagement, whether it's however you're choosing to do it, virtual or in person or hybrid in person. And that jives with what we learned in our survey as well. We ultimately were interested in describing the landscape, this slide here that Will presented, but at the same time too, we wanted to capture a little bit more data about the why of programs, what drove them and what motivations made them switch or stay. How satisfied they were with their changes in a post-COVID era, and also whether or not they really understood what their peers were doing. When we asked programs, like, do you know what other programs around you are doing? Is this sort of a herd mentality where people are going, oh, everyone's going back to in-person, we got to go back to in-person? The data actually suggests that most programs are fairly unaware of what their peers are doing. About 2/3 of our respondents had fairly little idea of what other residencies were doing in terms of conference planning. There's probably a geographic component to this. I mean, you're probably aware of what your geographic or close peers or near peers are doing, but by and large, it doesn't seem as if people were making decisions based off a perceived national trend towards one conference modality or another. Despite being somewhat unaware of what other programs are doing, programs are happy with what they're doing. They're satisfied. About 75% of our respondents like where they are at this time in terms of either being in person or hybrid, suggesting that in making the decision to either stick or twist, they were doing it with an eye towards the unique realities of their programs, their learners, their logistical considerations, their institutional mandates, things of that nature. We wanted to also get a little bit more at the why. Why did you do what you did? And I should just point out, as you look at this bar chart here, these are counts, these are not percentages. So this is the number of times residencies clicked a radial button saying, yes, this is a motivation for why we did what we did. So the numbers are gonna vary. And some of these things have face validity to them. It should not be surprising that programs that have a hybrid or that are hybrid, that have a virtual component, identify convenience as a motivation for keeping a virtual component. We all know, as was pointed out earlier, it is a lot easier to Zoom in your PJs than put pants on. So that kind of makes sense. By extension, it's perhaps also not surprising that those who went back to an in-person model identified what they felt was improvement in didactics themselves as a result of it. They felt you could do simulation better in person. You could do small group learning better. You could have a better hidden curriculum in person in a way that you couldn't do in a virtual format. So that's overwhelmingly a motivation that they identified. What is interesting in the data that we received is that there are areas of overlap where both hybrid programs and in-person programs both identified as a motivation the same element, though they have different approaches to them. So for example, both groups felt that they were improving their attendance by having different modalities. Perhaps most interesting, both groups identified wellness as a driver for their decision, though obviously they're perhaps using different notions of wellness or thinking about how wellness is best achieved in different ways. And we can maybe come back to that later on. But both groups identified that as being an important motivation for keeping or returning their educational formatting. We also drilled down a little bit more among the hybrid programs. As Will noted, no program is 100% in EM. And so we wanted to see how are they deploying virtual? Is there a type of content that favors virtual over in person? what I take away from this as a simulationist is that no one likes to do virtual sim, among other things. This is the again, these are counts, not percentages. So overwhelmingly, the preference of programs that even have a virtual component is to always do things like simulation, always things like procedural trainers in person, which makes sense. I think the other thing that I would take away from this graph is, or this bar chart, is there's actually no modality in which virtual is the preferred form of content delivery. The one that comes closest to this is oral boards. And that kind of makes sense because oral boards, at least for the near future, are virtual, and there's a symmetry, but that will change. At best, there's sort of equipoise between a preference for in-person versus either or, whatever works. And that's particularly true in content types like lecture, which does admittedly make an enormous component of our general conference programming. But again, even hybrid programs are not saying that we prefer virtual in general to other forms of in-person training. I'm going to pause again for a moment. Does this data jive with your experiences as residencies? Again, there's fewer hybrid programs here, but I'm curious to hear whether or not this echoes the sentiments of your residents, of your faculty, of why you've made the decisions you did.
So I'm in San Antonio. I'm actually the EMS Fellowship Program Director, so peripherally, obviously, with the residency. And a couple things that came out of this, I think, we are in person, but we talked about how we still stream our courses. And from the wellness, it's interesting. One of the things we've done is when you're overnight, the rule used to be you had to stay till 10 and then go home. Well, you can go straight home and you have to Zoom in until 10. So at least from a safety wellness standpoint, you're already at your house. If you fall asleep kind of thing. But we definitely, the views seem pretty similar to what we found as we transitioned back. One thing interesting too, on the fellowship side, and we're a little unique, we're one of two, we have a fellowship and the military has a fellowship, so we have a total of about, up to, I think right now we have 7 or 8 fellows total, so it's pretty big for a fellowship. Because of COVID, we started doing a Wednesday night, 7 o'clock Zoom as really just what happened this week in the early phases because we really couldn't be together. And interestingly enough, we still do that to this day because it's a time, it's kind of it's not really structured per se, but the fellows, we kept trying to sunset it because it's kind of an awkward time with the kids and put them to bed and stuff, but the fellows kept saying, no, we really like this because it devolves into cases of the week or war stories of those. So I think even though we're completely in person by requirements, we still have some of that hybrid aspects.
So one thing that sort of came out of this that's really hard to capture visually or objectively was, as we were reading through, we realized that different programs have different thought processes as to incorporating things like simulation and procedural training and POCUS. Some people consider that part of their conference, part of their residency didactics, and for some programs that happens at a separate time. So it's not necessarily part of their conference or part of their conference didactics. So looking at some of this data, it's kind of interesting to sort of parse through even programs. So this probably actually leans a little bit more towards the in-person approach in that some programs don't even consider simulation part of their didactics. It's just another teaching modality that they do, or they don't even consider, their M&M. They wouldn't include that in their usual didactics. So I was just sort of wondering if we could just take a poll of the room, or we could just get a temperature in the room of how many people during your didactics time slots, that your kind of protected time for residency, do incorporate simulation. Okay, perfect. And then how many folks, I guess the opposite would be, right? How many people have things like procedural training, simulation, or some component that happens regularly and may even be mandatory, but is outside of that didactics time? Yeah, there's a couple. Yeah. Because we also have some component of, at WashU, we have some component of simulation during conference didactics time, but we also have quite a bit of our simulation happen outside. So I was just kind of wondering, that was one of the things that, we only had so many questions that we could put on the survey until it became exhaustively long and people wouldn't answer it anymore. But that was just something that I was hoping to get out of the room or the discussion today.
in that vein too, I mean, obviously our survey, the lens of our survey was the perception of educators, what their intentionality was in creating what they did. One thing we did not capture is the perception of the learners. At my own residency, I'm on the program evaluation committee. I hear from my residents, we like virtual. We would like more. I mean, they like in person, but they also see that as valuable. So I'm curious if especially, in your earlier training years when there were years that probably started out virtual and reverted to in-person, was there pushback from your residents? Like, what is your sense of how they perceive their conference planning? It sounds like at your institution, they drove it. But.
Right. They drove it, but it's interesting that we just graduated our last year graduated the group that started as virtual and then moved to in person. And now we have the interns who have all been in person, and they're kind of like, well, we wish we could do some virtual. And it's like, I don't think you know what you're asking for, because you haven't actually, they had it in school, but they didn't have it in residency training. So it's kind of an interesting dichotomy that the ones who started that way didn't like it, but the ones who haven't had it are asking for more.
Exactly.
Any other perceptions on what your residents feel about it?
At UC at the time, I remember when we went back to in-person, and it was phased in because of the way that the restrictions were in Ohio. So we were 100% distanced, lecturers lecturing from home, streaming their own screens. And then due to technology issues repeatedly with, I had poor internet, or, something crashed, we brought the lecturers in. So the lecturers were the only ones in person, and everybody else was at home. And then as we phased it back in, we kept the lecturers in person, again, streaming. But then for cohesion, as our new interns came that first year where we could kind of be hybrid, the interns were always in person to set culture. And then the other classes rotated. So it would be intern plus 2, intern plus 3, because we had to maintain the distancing with our physical space. And our physical space was too small to bring everybody back. And so there was an overlap period where we wanted the interns to have the in-person experience because of orientation and meeting people and cohesion. And then when we could bring everybody back, everybody came, but the faculty lagged. And so it's the faculty attendance that has been the greater issue. Again, the residents, I think, do want opportunities where they're like, could we do this hour virtual? Could we do this hour asynchronous? From a wellness standpoint, largely. But the interaction of the faculty in person versus the faculty in the virtual space, even with Slack, has not rebounded to what it was, despite the ACGME requirements being no different. It's just the way that the virtual option is heavily used by faculty.
They're not alone. I have more of my faculty coming in virtually than I do in person. So thankfully, they still do interact, and they're encouraged to turn on their mic and interrupt and talk when they have a point. But I would like to see more of them coming in person, and I think the residents would too.
I think it makes sense, right? If you're a learner and you're going to have an hour lecture, why wouldn't you want to be at home in your PJs to watch that if it's no different than, driving in and being in person? I think it just depends on the amount of time you're doing. If you're doing 4 hours in a row, that's probably not good, right? I know there were studies that came out during COVID showing that people aren't engaged during virtual learning. Obviously, they're probably not the best quality studies, but, people's videos are off, and who knows what they're doing? So it's kind of like one of those things for me. I'm like, well, what do I want out of this? What's the outcome? If my goal is that they are, again, engaged and learning, I think that it makes sense for them to be in person, but I'm not opposed if it's we want to do 2 hours of lecture, why not do it virtual? So I think that the question is probably a little bit more nuanced in the sense of what is the content you're teaching? How long are you teaching it? What do you require engagement-wise? And that sort of thing.
Hi, I'm a resident from Michigan, echoing a lot of similar sentiments. But I think on that vein, I'm curious, we talked about how certain lectures, certain formats are more favored in a virtual setting or more compatible. I'm curious what the active learning stage is, if you guys have found certain simulations, certain tools. I know we use Kahoot a lot to kind of engage the learner virtually that have bridged that gap with the distance of being online, being camera off. What has helped with that?
Like we use Kahoot a lot. We used Kahoot a lot during our virtual COVID, and it definitely increased the engagement. But I think that sometimes when you're in it, you don't always know, and I don't want to say it this way, I'm still pretty young, but like you don't always know what's best for you. So I think finding that balance is important, and I think that including active learning, just because you're virtual, you don't need to completely exclude like opportunities for active learning engagement. But I think having the balance is important, and thinking about how you're providing it and what the benefits and negatives are is good as an educator. So.
Hi, I'm Lindsay. I'm a resident at WashU. I was just wondering if you guys have any experience with differences in ITE scores or anything like that amongst your residents, because I know at WashU we talk a lot about doing some virtual because we're all in person right now. I'm just curious what your experiences have been with actual measures of test scores and stuff like that.
That's exactly what I was going to say. We didn't change our Rosh review concept with it. We kept it going. And so we haven't seen really any differences in the test scores. But I think there's a difference between learning the knowledge that you need to have and learning the knowledge for the test only. And I think that's one of the biggest differences between, I don't like using the ITE scores per se to say that conference is working or it's not.
I would add anecdotally at our program, we have a virtual ITE session that's held. It is independent of conference. It's layered on top of it. Anecdotally, I believe our scores have gone up. Whether or not that's correlation versus causation, hard to say. But it is a way, in that instance, having a virtual option and the convenience of it helps clear the energy of activation of getting residents there and getting them to invest the time in additional IT prep. So again, this is not strictly conference. It's more just using the virtual format, but it's something where we recognize that there are avenues and places where having that convenience factor greases the wheels significantly.
Hi, I'm Marcia Perrier. I work with Will over there. I'm just asking from this faculty standpoint, and generally, do you have rules around the virtual Zoom presentations for your residents in terms of camera on, camera off? As a faculty, I actually hate giving my lectures over Zoom. And especially so in small group, not so much for the big emergency medicine didactics, but for other small groups where people have their camera off, or we have a visiting professor and people have their camera off. I really find that kind of insulting. And so I wonder if rules around people having camera off, camera on during certain portions of it, how do you navigate that to kind of get engagement?
Thank you for your timely question. I'm going to turn it over to Jason. Well, thank you. We should answer this, and I'm curious to hear what the group thinks, but I'm going to turn it over to Jason, who's going to talk about some of this as the next section.
All right, excellent, yes. No, thank you for transitioning us very, very well as we kind of discuss the kind of last portion of this talk. So obviously there's a great transition back towards in-person, but virtual is probably going to still be a component of all of our lives for the foreseeable future. So what we tried to do here was just summarize a little bit about what the best practices are in the literature for virtual conference. And obviously these can be applied to in-person as well. So while each paper had kind of their own unique tips and recommendations, their kind of overarching themes came together that we're going to speak about here. So the first, obviously, this can be both virtual and in person, but having someone who's really kind of the moderator of the conference, whether it's a faculty member or a chief resident who's moderating the timing, introducing people appropriately, especially in the virtual setting when there's the transition between lectures and topics, is essential. We've already kind of broached the topic of software issues and transitioning even the lecturers back to in-person so that the software issues could be addressed in those things. So doing tech checks, making sure that presenters are aware of what's going on, but also if it's a virtual, knowing that the participants know how to use the technology, know how to use the chat system, those type of things. Real-time audience participation. So we've already kind of broached this topic, and it's certainly very important. Having active learner engagement, whether it's via the chat. I love the idea of Slack actually over Zoom, because we have our moderator moderating the chat in Zoom, but there's a delay sometimes, and even if you're if you're on your phone, it is not easy. So I may bring that Slack back to BI here, which is great. As we were just talking about, etiquette and expectations on attendees and presenters. So that was a great question. I was going to ask here, show of hands, who still have virtual components, or when they did have virtual components, who has a mandate that residents have their cameras on? Who's here actually keep their cameras on? Yeah, right? We're maybe at 50% in those type of things. And I know plenty of times when I'm presenting and I call on someone and their camera's off and then there's no answer and they're not there. And that can be obviously translated to in-person as well, right? We are a technology-driven community now. We use our phones, we use our computers, but setting the expectations in an in-person setting as well of being engaged in the discussion is certainly important. Other things, recruiting speakers and content from outside of your normal EM community, so whether it's interdepartmental or really interinstitutional. So that is the one great opportunity with virtual, right? The lack of cost of bringing a different institutional person to your talks. All you need is their time. You don't need to pay for travel. They don't need to travel. It's actually a pretty great opportunity in that. So those are things to kind of encourage when you are continuing with a virtual setting. But if you can bring them in on an in-person, equally as important. And then, as we kind of talked about, these are simple but important for all. But building in breaks is 4 hours or 5 hours of Zoom, or 4 hours or 5 hours of sitting in person is not ideal. You need to have breaks. You need to stretch the legs and have bathroom and water breaks. Evaluation response. So ensuring that the participants can tell you what's going well, what's not going well, both in person and in virtual. Obviously, probably a little bit more in virtual, but lecturers and methods of how you're presenting should be continually evaluated, and then ensuring that attendance, obviously. In person's a little bit easier sometimes. You can see the person, you can check off having a chief resident or obviously your faculty moderator doing so. But on virtual, how you're ensuring that the people who are actually there are truly there and getting credit for truly being there, and how you actively do that. At our institution, we use a honor system of a Google Sheet, so you sign in for each lecture that you're doing. It is honor, but most people are honest on it. So as we get to the last discussion here, we just kind of wanted to open it up to see who's actually using some of these best practices in their virtual or in person now.
Yeah, we're 100% in person, but we've used the best practice of inviting outside speakers. So we've had Amal Matu come and talk to us. We've had Jess Mason come and talk to us virtually. And so it definitely, the residents love it, that they can get a quote unquote national speaker to come and it doesn't cost me a dime. And I love it.
Do you all find that if or when you have guest speakers come virtually, residents are better about keeping their cameras on, or is it something that you have to ask a lot of your residents?
We brought the residents in person still, and so the residents were all in the same room. We had the residents in person, everybody was, and the only one that was virtual was the speaker. And so they were on the big screen. We had, the big screen is the one with the podium. And then the chiefs still kind of had like a separate Zoom screen so that if there were some virtual participants, because again, we would offer that to those that were on parental leave, those that were on, an ICU rotation, et cetera, and for our faculty that were choosing to not attend. But I do think that, again, we can actually get a little bit better faculty. I'm in faculty development now, is my passion. So, getting the speaker still would get more faculty in the seats, even though the speaker was actually virtual. So a little paradoxical.
Great, and kind of one last question, which still kind of pertains to all of this, but how have you taken lessons learned in the virtual world to kind of change your in-person didactics as you've transitioned back?
So although it is kind of a running joke that it's been 4 years and we still can't figure out the technology every time at conference, we're getting better at it. And I think that's one thing where we don't have to call departmental IT near as often. And so I think that's been helpful. Although I think that is still a real frustrating component to this, is that it does seem like, every couple weeks, because we stream conference even though the only residents allowed to be at home are the ones post-call or post-night, maybe if they're off-site. And the faculty, for getting to the camera thing, the residents are pretty good because they are required to keep their camera on when they go home, and that's the faculty is not good at all. And I think it's part of that I don't know what to do with, because the way our structure is set up, you don't see, the people in the room don't see anything, right? It's the person off to the side kind of running the show. And let's be perfectly honest, when you're faculty, you're probably doing 5 other things on purpose. So it's like, I'm listening in, if I can chime in and engage if it's something relevant, but I'm not, I'm sometimes on another meeting at the same time. And so I think the camera thing becomes an interesting question for faculty, maybe more than residents.
So I agree. I find it's a little bit hypocritical because as faculty, we, multitask, so we say, and we do many different things, and we're on Zoom meetings, and we're doing our charts, and conference, we're doing our charts. So I have to recognize that, but I specifically require for this one course that I run that when we have guest speakers, everybody has to have their camera on. And for the other times, what I say is, I know life gets in the way sometimes. I know this is an evening course, and it's dinner time, and it's children. I need you to put your camera on sometime, and if you need a 20-minute break, take a 20-minute break, because it's a 3-hour course. So I think there has to be some flexibility with like everything else we do. And for very large groups, I really don't care that much, but.
So I have a relatively small faculty for my size of my residency. So a quarter of my faculty is actually covering the department while my residents are in conference. But I don't require them to put their cameras on, because a lot of times they'll Zoom while they're in the department. And so even though they are not always 100% there, they're hearing stuff. And I'm actually seeing them come downstairs more to conference. Our conference room is directly below the ED. And so they'll run downstairs and say, hey, I got a point to tell you about this, 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 and this. And they'll run up something quick, do a 5-minute real quick thing about what they had caught earlier in conference, and then they'll run back upstairs. So at least it gets them a little more engaged and sometimes more time in the, in with the residents.
I wish we had that. We're 5 buildings away.
Yeah. Our offices are literally down the stairs.
We did, again, speaking for UC, at the time, we did change the way that credit was given. So for residents that are choosing to attend virtually, to make sure that they still had the interactive component to meet the engagement aspects, And this still continues. For those that are streaming on like parental leave, you have to post a certain number of comments to the Slack, and that is actually monitored. So it's one thing to be logged on while you're on a global health elective. It's another thing to participate when you're logged on a global health elective, and then they can get credit because we're always quite close. And the same standard. The faculty tried to argue for the same standard, but again, we held them to the ACGME letter of the law of you are there to interact. The purpose of conference is not for you to learn, although I want you to learn. The purpose of conference is for you to interact with the residents so everybody learns. And so for faculty, we actually cut the credit that they get for virtual attendance. It's 25%. And so you get full credit for being there in person. And yes, you have a virtual option, but it's going to be really difficult to meet your conference requirement if you never come in person. And maintaining that delta, it's unpopular, but I think by the letter of the law and the spirit of the law, it's consistent.
We're at time. I was just going to say I agree with the lessons learned. Flexibility is key, and thinking about the experience you're providing when you're in person, like we're going to have breakfast, like everyone needs to eat. It's early. So things like that, I think, are kind of the lessons that I took away from COVID and that time.
Well, thank you all for participating and joining us, and enjoy the rest of the day.